Are we ready for her?
Yeah, we're ready.
Ready?
Yeah,
Okay. I'm gonna go get her and we'll be back in probably 10 minutes. All right? Thanks. We're gonna start this awesome 2-day process as we've seen so many times before. So let's make this magic happen as we do. This is a Texas adventure. If I can get out of the car. Here we go. There she is. Kathy! How are you?
Welcome.
Oh, you look emotional. You gotta save that for like tomorrow.
All the time.
Why are you upset
Welcome to
already?
Texas.
Thank you. How you feel?
I'm wonderful.
You look good.
Thank you.
This is gonna be an emotional one, guys. But we'll take care of you. That's a good sign.
Oh, I see G4.
Oh yeah. You just have so much emotions going on.
I do. I cry when I'm happy. I cry when I'm sad. I see something and it's just.
That's good. It makes my job so much easier. Okay, so we are here in the Dallas G4 offices with our awesome new patient, Kathy. We just arrived. She filled out her paperwork.
I did. I'm so excited. Words can't express. I'm going to have a beautiful smile.
Yeah.
Here I go. It's something I've wanted all my life.
So tell me a little bit about that. How long does it go back to when your teeth first started having problems?
Probably 25 years ago. You know, when I first had my crowns put in and caps.
So you had crowns 25 years ago?
I can't remember. It's been
around.
Yeah, somewhere in there. But and then just my teeth just started really deteriorating, and the last episode I had, I went and bit into an apple, and my tooth came out with it.
Oh, that's always fun.
And I was at work. I knew something was going to have to give, so I just started researching, and I came across a G4 by Golpa. And from a medical standpoint, it didn't really bother me because, I've undergone some things.
Like?
I had breast cancer. I'm not usually this emotional about it, but so that was 32 years ago. So
Wow.
I will tell you, my husband was wonderful. He was very, very supportive, and went through all of the.
Was supportive is.
He.
You don't have to go there if you don't want.
No, it's okay. My dad died April the 4th of '92, and Andy died May the 16th, 6 weeks later.
Andy's your husband. Wow.
Yeah, so that was a.
Whew.
That was a time when I thought I was going to go off the edge.
Yeah, it's safe to say that you've been through it.
I have.
You've been tested, and it's no surprise that your teeth have taken a secondary. I mean, just with what you're telling me, I'm not surprised that the teeth weren't exactly the most important thing going on for you. But I think it's a testament to your strength and to your courage, and I'm so happy to sit here with you because I just love courageous women, courageous men. What do you think your husband would be thinking right now?
Wow, I dream about him a lot, and I haven't actually talked to him about this, but I think he'd really be happy about it.
Happy for you.
Yeah.
Because this is it.
Yeah,
this is going.
I know
this is going. It's going away.
Thank God.
Yeah. Me personally, I think you're still a beautiful woman. So don't. You're gonna just. You're just gonna look better. I'm just kidding. You have any money? That's why I'm.
I know,
right? So you ready?
I'm
Let's
so
do it.
ready.
That was great. You did really good there. That
Thanks.
was very good. Very good. Liz, what are we doing? Can you take her? What are we doing? Where are we going? CT? Kathy, it's CT time.
All right.
Follow Liz. Now we go to the fun process of having a nice CT done, get the whole full mouth, bone density, what it looks like, where we're, placing implants, and this is really what's going to determine where they do their magic. And as you can see, it's pretty high-tech stuff, and it's cool. This is just part of the process. From here, we'll take her into a room, do a little bit more individual x-rays to really get a good look. Then we take all that and put it into a nice computerized machine, and we'll know exactly what situation she's in.
We're going to be best friends. I know, we're already best friends. My bestie.
By the time this day is over, we're go ahead and bye.
These are going to be ready for glamour shots, aren't they?
We'll take glamour shots.
This is the good stuff.
This is the Ellen thing.
Yeah.
Cheese.
And then open slightly. Right there. Awesome.
You did it fast.
You can take those out.
Would you like to take a tour of the lab and see how everything's
I
made?
would love to.
So,
Wow.
do we have any idea who will be really working on Kathy's teeth, or will it kind of be everyone?
Well, pretty much everyone, but we have to do the smile design before,
Yes.
right? So we're going to make the smile design. We're going to have a more accurate idea of what
Okay.
we're going to do with you.
And she's awesome because she's a chef's choice kind of gal. Yeah. So whatever we think looks good, she's absolutely.
Excellent.
Yeah.
You-
Okay.
Of course, we won't want to give you something far from what you have right now, right?
Right,
We want to try to give you something natural, improve it, but
Exactly. And, you know, you're the expert, so I'm in your hands.
we're here. Yeah, you're in good hands right now.
Yes.
Okay. Did you look at that?
Oh, don't. I can't believe I fell for that.
I know.
Okay, so nice to meet you.
Nice to meet you.
We're gonna work a little bit in your smile design, okay?
Okay.
We're gonna paint the shade, the shapes, everything what's gonna be working, and it will be help us to
Okay.
design your
Okay.
smile, okay?
Okay.
So our smile show a lot of things.
You what? I don't know what she's.
Number 2.
Number 2. Oh,
Sorry, just haven't had that one.
yeah, right.
Me neither. Let's continue.
Well, this is
Ah,
this is some information that our smile show to the people,
Okay.
right, to the world. We're gonna
Really?
design your smile.
Oh,
Yes.
that's really.
Yeah, this is the choice I'm giving you today
Wow.
to pick. For example, all this information you have in your mouth and people is looking about it.
based on what he just told you, I mean, I think it's a no-brainer. You're gonna follow they see this all the time, but would it make sense to do soft and feminine
For
Because
her,
that's
for
me.
her?
especially
Because you're
because
so soft and feminine. That's good. And now what about
perfect.
color?
color. I explained to her about the difference between the G3 and B2 we're working with, but
What do I have?
no, you are what you're G1?
A crazy white.
Yeah, well, but you picked that one.
I did
right?
pick that, of course,
Okay.
and I love it.
I'm B2.
My father's
Yeah,
B2
I
too,
think
so.
she the
And that's the
B2
natural look, right?
Yeah, that's the natural look.
Okay.
You're gonna put this in the side and smile and look in the mirror,
Okay.
which will be fit. Not in
No,
the
no, put it in.
right.
Yeah.
What?
Yeah.
So
Me
the
too.
B2.
So this is the one. Do the color.
Yeah.
Natural.
Yeah.
It's gonna be awesome. And believe it or not, when it goes in, we see it all the time. It actually looks whiter than.
That's what he
So,
said.
yeah, that's what I
That's
told her.
exactly what he
Well,
said,
that's
yeah.
not natural.
Yeah.
I mean, it's natural,
Yeah.
but it's just a lot.
Yeah, I don't want something that's going to blind people.
Hey, leave it alone, okay? I wanted that.
Okay, so we're
My
set up.
teeth are in your hands.
Yeah, and you are in good hands.
I know.
Nice to
Thank
meet
you so
guys.
much.
Dr. Anderson.
When we evaluate a case, I mean, it's about two things, quality of bone and quantity of bone. Basically, I'm just trying to make sure that she has enough foundation left so that we can give her support, so that we can give her teeth with a good foundation. She has a lot of infection around her teeth. I don't know if you want to zoom in here and look at it, but this big black area up underneath the tooth is infection. Black spheres are infection. That's supposed to be bone there, which would be white, but it's black, which is pus and nasty debris. Anyway, she's got a lot of infection. She's got a lot of bone loss. There's not nearly as much bone around her teeth as there normally would be. But thankfully, her bone appears to be very hard.
Do you find that a lot in most people, that that's a common thing to see?
Certainly in our patient population.
Yeah.
Um,
So that's
Yeah,
not
absolutely.
a problem going into surgery.
no, not at all. This is every day for us.
So on a scale of 1 to 10, complexity-wise for her case, what do you think? Because we've seen so many that are...
The 1 or a 2. I mean, it's very straightforward.
Okay.
There's still a lot of bone left, and the bone is hard.
No sinus lifts,
No, nothing like that.
bone grafting?
I doubt it.
Okay, wow, that's pretty good. So we brought you a good one.
Absolutely.
An easier one this time.
Don't need coffee this time.
Good,
That's good.
So let's let's go meet Kathy and let's get this show on the road. I know everybody's excited, so.
Let's do it. Kathy, what's happening? Likewise, Todd Anderson. How you doing?
I'm doing well, thank you. And you?
Great. Our job is to engineer your case in such a way that you're not going to have a problem while you're healing. We love doing surgery, but we only like to do surgery once. We don't want to come back and do additional surgery.
I'm with you on that.
Just by virtue of the fact that we have our teeth, the root's embedded in the jawbone, so when you eat and chew on the tooth, it stimulates the jawbone, it makes it more dense, so you get density and it keeps it from resorbing. So you're a fairly straightforward case, you've got a lot of bone, and it's of good quality.
Good.
Very good.
I'm ready.
We'll do the smile design.
Okay,
All
sounds
right.
great.
Thank you.
Thank you.
There you go, Tina.
And by the way, you have beautiful eyes here.
You're just trying to butter me up. I know what you're doing.
No, they're really, they're hypnotizing.
The moment we've been waiting for. Take a nice nap. That's my only advice for anybody for surgery. This is like, it really is taking a nap. As soon as you get that little tiny IV sedation, you talk to the anesthesiologist for maybe 2 minutes and then you remember nothing until you wake up.
So how many counts do you think I'm gonna get?
Not 2.
2?
It's not even. It's like, yeah, it's nice.
I'll go for 3.
But the weird thing is, it's conscious sedation, it's a twilight sleep. So she's not going to remember anything, but when they say open your mouth, how you feeling, she's going to respond. So this is where we ask for your social, your bank account information, you know, all the stuff that we need.
How much money I had in my purse, how many credit cards.
Exactly.
Yes.
Come on, let's go. Let's go to the surgery room.
I'll go this way.
Yeah.
Hi.
I'm Dr. Stewart. I'm your
Kathy.
Sandman.
Oh, Mr. Sandman.
Yeah, I'm going to be sure, make sure that you're nice and comfortable through
And did
this
you
whole
sleep well?
affair. Me?
Yeah.
No, I only got about 2 hours.
Oh, well, me too.
No,
so
I'm
you're gonna
good.
put me to sleep.
And then I'm going to sleep too.
Oh, good.
No, this is going to be real easy for you.
There you go.
Am I going bye-bye now?
No, but smack your lips. This is breakfast and lunch.
You're funny.
Hanging in there?
Yes, sir.
Making sure she's mom. I'd rather find out by doing something gentle than something not very gentle.
Yeah, don't talk, and especially don't talk with your hands.
That's how we get strong forearms. Taking out hundreds of teeth.
First time I watched him go surgery, he looks up and he goes, like midway through, he goes, Jared, you should probably step out. And I'm like, it's that obvious? I was like white as a ghost. I felt so sick.
Well, you were about my color, so I
Yeah,
knew that
exactly.
you were getting in trouble.
The spray tip didn't help me at all.
Basically, just getting everything nice and clean, putting away the tissue back. So we got all the teeth out. Now we just got to give her some support, give her some implants. So the whole reason why this procedure works so well, the reason why you can give somebody teeth immediately that they can chew on and it doesn't fail, bone really likes to be loaded while it's healing, but it can't be overloaded. So the idea behind this is really just one of surface area. You're distributing the force of the bite over a large surface area contact of implant and bone. And in doing so, it heals very predictably. The handpiece I was using will only put it in at a certain amount of torque. And if it's too tight, you got to ratchet it in past that. This is what the bridge is going to seat on tomorrow.
Same process. They're gonna extract her lower teeth, get her numb. Dr. Hunter's gonna get her numb. Extract the teeth, then they'll extract the teeth, and then implant placement, right?
Mm-hmm.
You look like you want to say something. Am I right?
No.
He goes,
No, it's just silly. People have reversed my names all my life.
Yeah, you called him Dr. Hunter.
What did I say?
You called him Dr. Hunter.
And you're Dr. Stewart.
Yeah, Hunter Stewart.
Or Jim Bob.
My apologies to Dr. Stewart. We're not on the friends
better.
level yet, so. Doctors. They earn the title. Don't get it wrong.
It's all design, really. On the upper, we're talking about sinus lifts, right? On the upper, that's anatomy that you have to avoid. It's just an empty space. So you put an implant in there, nothing's going to happen. Nothing for it to grab into or heal. So sometimes sinuses come really forward on patients, we have to avoid those. Sometimes we have to do sinus lifts, sometimes we have to do 2 stages, things like that. On the lower, what we're looking at is where the nerve exits. The nerve runs down the length of the jaw and exits about midway, and you don't want to put an implant through a nerve. So sometimes we have to cluster implants closer together, more so than usual. And so then we have to place maybe some more farther back, right? Maybe where the molars are, but a shorter one or a smaller one, because we have to avoid the nerve. And you look at the torque values that you get, sometimes the bone is soft and overall, so you just want more stability.
So the fact that she didn't need that doesn't actually change any of her results tomorrow.
No.
Same type of strength, same type of...
Yeah, it's all good. We have really good spread from the front to the back, and we've got good size implants with sufficient torque. So the more simplistic you can design it, the better it's going to be, typically.
Easier to take care of.
Sometimes we have patients that have 8 implants, 7, 8, we have to do what we have to do. It just depends on what's there when we get started. But she was a really straightforward case, and she's great to work on. She's chilling.
Kathy's done. They're cleaning her up, sewing her up. Implants are placed. Everything went good. She was a great patient. Levels were great. This is what to expect. This is one of those relieving moments where we had no complications, no complexities, and she's going to be a different person tomorrow. Obviously tonight it's going to be the same thing we always say. Icing, take it easy, soft food, stuff that, because you're not going home with teeth, you're going home with just these implants and abutments. So she's apparently been an amazing patient, and now we're going to, there's a few more laboratory type stuff that we have to do. Tomorrow, magically, she has a new set of teeth. So it's a pretty well-oiled machine here. I mean, they're so used to it now where we're sitting here talking about movies and while they're placing implants in somebody's bones. So it's just wild how second nature it is. But I'm happy. I think she's gonna be happy. Where did we get tote bags? Holy crap. We got totes. I never had a tote. You ever get one yet? We'll get totes today. Let's go.
How'd it go?
It was really good.
You feeling okay?
I'm feeling great. No pain. Tired.
We got a big day tomorrow.
I know.
Most patients are really tired right now. The cool thing is everybody walks out like this. You're gonna be sore, you're gonna be a little tired, you've been in the chair for hours. Now she goes back to the hotel, rests up, uses some ice packs, has some pudding. Tomorrow the magic happens, but for everybody the anxiety is the surgery. So once you get out and you're done, you're like, that's it?
Yes, it was nothing.
And it's really an easy thing. So tomorrow we do the big reveal. So we'll see you guys tomorrow.
Thank you.
You have everything? Your phone, your purse?
Purse, glasses.
Want me to carry anything? Oh, shit. Too tired for that. Okay, so it is day 2 here at the G4 offices in Dallas, and Kathy's teeth are made. She's super excited.
It's nothing. It's a piece of cake. I would do it all over again. I would recommend G4 by Golpa to everyone because it's just, I can't wait to see my bridge in my mouth. I mean, it's beyond. I'm going to start to cry. It's wonderful. It's a dream come true.
Okay, the time has come. The moment we've all been waiting for, I think Kathy more than everyone, but all the nerves, all the excitement, all the surgery, everything, all the team, everybody goes through. It comes to this moment where she's gonna see her teeth for the first time. Look, she's crying already, which is awesome, but this is the time. So Kathy is going to see her new smile for the first time.
Oh boy. Oh my God. Oh, it's beautiful. Oh boy. I have never, ever thought it was going to be this great.
What do you think?
I love them.
I'm happy. Are you happy?
I'm very happy. I am very, very happy.
You said you'd cry.
Oh, she cried. that she did.
I am.
It was awesome.
They look awesome. I'm happy for you.
I'm happy for me too.
And that's what that's what I like to see most, when you laugh like that.
I'm really happy.
I mean, that's what it's all about.
Yeah. So I'm just excited to be able to go on to the next phase of my life. Yeah, not have to think about what am I going to do? You know, can I eat that? I can take a full-on bite and chew and just enjoy food. But I've had family along with me all today, so it's that makes it special. And so I've got a lot of family looking down at me and smiling today.
Oh, you've gotten me enough for 2 days, please. Let's go have dinner.
Okay.
Kathy is about to eat a steak for the first time in a very long time, at least a proper. Is it cooked to your liking?
It is beautiful.
So exciting. Here we go. First bite.
Okay. We have to do a little au jus.
Ooh.
Yeah. Oh, that's good. Oh, that's really good. I like
So
it.
she's gonna enjoy her dinner now.
I am.
So happy for
Thank you. I'm happy for me too.
you. Have some potato, because I'm getting hungry.
Oh, gratin.
That's good.